Hi there, in this video I'm going to show you some simple home remedies that you can use to H. pylori. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. H. pylori was the first bacteria to be formally recognized as a carcinogen and is an underlying root cause of many gastrointestinal disorders. Researchers and sufferers have been wanting to find how to cure H. pylori since its role in stomach ulcers was discovered over 30 years ago. And with the conventional triple antibiotic therapy no longer considered gold standard because of low success rates, H. pylori natural treatment approaches have become increasingly well-researched, effective and preferred in clinical practice in recent years. Having helped hundreds of clients at the functional gut health clinic eradicate H. pylori in recent years using natural protocols, we're excited to share both our understanding and current approach. What is Helicobacter pylori? Helicobacter pylori, H. pylori, is a gram-negative spiral-shaped bacteria that can be found burrowed into the mucosal layer of the stomach. Although it is thought to have been infecting humans for thousands of years, it was only discovered by two Australian researchers in 1982. Who went on to win the Nobel Prize for their discovery in 2005. Nobody thought bacteria could survive in the highly acidic environment of the stomach, but it is now known that H. pylori can hang out there and cause up to 80% of gastric and other GI ulcers, chronic gastritis and stomach cancer, amongst other upper GI symptoms and conditions. It manages to survive this harsh environment by burrowing into the less acidic mucosal layer that lines the stomach that protects it from its acidic habitat. In early phases of H. pylori colonization, many experience low stomach acid, hypochlorhydria, and its associated symptoms. Over time, additional H. pylori strains may colonize, including those with virulence factors that bring increased risk of symptoms and disease. More on this below. Because H. pylori can colonize its host for life, it can create chronic symptoms and long-term health complications in many sufferers. H. pylori prevalence. How common is it? While it is estimated that around half of the world's population is infected with H. pylori, the rates vary widely by region and socioeconomic status. For example, it is estimated that and GT. regions with the highest rates of H. pylori infections are Africa, 70%, South America, 69%, and Western Asia, 67%. And GT. regions with the lowest rates of H. pylori infection are Australia, 25%, Western Europe, 34%, and North America, 37%. And GT. According to the CDC, in the United States H. pylori is more prevalent among older adults, African Americans, Hispanics, indigenous Alaskans and lower socioeconomic groups. And GT. It is estimated that in the United States, the prevalence of H. pylori infection is 20% for people younger than 30 years old and 50% for those older than 60. As such, it is not normal for those under 50 years old who aren't from an at-risk ethnic or socioeconomic group to be infected with H. pylori. And given the symptom profile and long-term consequences of H. pylori discussed below, eradicating it should be a priority when identified on testing in symptomatic clients. H. pylori transmission. Is it contagious? H. pylori is thought to be transmitted from saliva, vomit or fecal matter, but the exact route is still not clear. The most common ways to catch H. pylori are likely kissing, pre-chewing food given to babies, contaminated food or water, poor hygiene e.g. lack of hand washing. Given the increased prevalence in certain regions, traveling to developing countries may increase your risk of H. pylori infection. However, according to the CDC, Short-term travelers aren't at significant risk of H. pylori, but expats and long-stay travelers may be at higher risk. Our body's immune system is designed to prevent infections like H. pylori. Because it resides primarily in the stomach, our major defense mechanism is stomach acid. As such, those with low levels of stomach acid may be at higher risk of H. pylori infection. We talk a lot about stomach acid in this blog, but in short, the main contributors to low stomach acid are and GT. H. pylori itself, as it produces ammonia as a byproduct to neutralize stomach acid. And GT. Age, as our gastric acid secretions reduce as we get older. And GT. Stress, physical and emotional, which can impact the production of stomach acid. And GT. Deficiencies in vitamins or minerals essential to HCl production, E.G. Zinc and vitamin B6, which may lead to low stomach acid. And GT. Proton pump inhibitors and antacids, which are specifically designed to reduce the volume and acidity of stomach acid. And GT. GI surgery, E.G. Gastric bypass surgery, that can reduce the amount of stomach acid produced. Studies have also shown those with lower levels of vitamin D are more likely to be infected with H. pylori. As with stomach acid, this is thought to be a result of vitamin D's importance in modulating our body's innate and adaptive immune responses. Potential long-term consequences of H. pylori. H. pylori is most famously associated with stomach ulcers, but emerging research has also identified potential associations with a number of other conditions, including and GT. Gastric diseases including gastritis, inflammation of the stomach lining, bile reflux gastritis, stomach ulcers and stomach cancer. And GT. Iron deficiency anemia. H. pylori competes with our body for dietary iron. And GT. Skin disorders found in 81% of rosacea patients who also had gastric complaints. And GT. Neurodegenerative diseases including Alzheimer's and Parkinson's diseases. And GT. Autoimmune disorders including Graves' disease and sclerosis. H. pylori's biggest side effect appears to be its ability to produce an enzyme called urease, which is hydrolyzed into ammonia to neutralize stomach acid and dampen the body's immune response. It is this reduction in stomach acidity that allows H. pylori to continue living in what would otherwise be too harsh an environment. Because stomach acid is an important first line of defense for our immune system to kill off ingested pathogens, the risk of further infections and subsequent conditions also increases. If you have H. pylori, we tend to find other pathogens or overgrowths in the GI tract for this reason. As part of its ongoing defense, H. pylori burrows into the gut lining, epithelial cells, and starts to create damage and chronic inflammation. While not everyone with H. pylori is symptomatic or develops these long-term symptoms, certain virulence factors may explain the variation from person to person. That is, not all H. pylori infections are created equal. The importance of H. pylori virulence factors. Basically, H. pylori infections carrying specific virulence factors, or genes, can lead to more severe symptoms and health consequences. Virulence factors are molecules produced by bacteria that allow them to increase their ability to cause harm by improving colonization, suppressing the immune system and obtaining nutrition. For H. pylori, these include the following genes listed in the table below, including cytotoxin-associated gene A, CAG-A, and vacuolating cytotoxin A, VACA, both of which can cause tissue damage and inflammation. Symptoms of H. pylori infection. Many people have non-severe symptoms which can lead to the belief that the infection doesn't affect them. It becomes a hidden infection that may present issues a lot later, making treatment that much more complex. but for others there may be any of the following H. Pylori symptoms.